Hey RP Plus, RPU, welcome back. Dr. James Hoffman here, and today we're going to be on part 2 of our movement anatomy series. We're going to be talking today about the shoulder and all its fun movements that it can do. However, before we start this video, make sure you go and watch the first video on movement anatomy to make sure you are clear with all the terms and directional movements and things like that. Otherwise, this one might be a little bit confusing. So just be sure you're up to date on all the movement terminology that we're going to be using, and then hopefully you can enjoy this video even more. So let's get started. So today we're going to be talking primarily about the shoulder. There's a lot of stuff going on with this, and we're going to try and keep it to the point and not too rambly, but we're going to be talking about basically how the humerus interacts with the clavicle, the scapula, and how we can do movement of the arms or the upper extremities. So it should be pretty interesting. And at the end, I'll give you some examples of things that we're talking about in exercise and sporting context. So let's get started. So when we're talking about movement of the shoulder, we're generally breaking down two major kind of subgroups or subregions within the shoulder because there's a lot of different moving parts. So there's two big ones, the shoulder girdle, or sometimes called the shoulder complex, and then the actual shoulder joint itself is treated separately for the most part. Now we can talk about them collectively and independently, and it's kind of hard to talk about them independently because they work together, right? But we're going to break it down a little bit, and then we'll talk about how those things move in conjunction with each other. So the first one, the shoulder girdle or the shoulder complex, generally refers to all the muscles and tissues interacting or acting on the clavicle and the scapula, right? So the clavicle being that collarbone right here, which I think is actually one of the statistically most broken bones out there, unless I'm wrong. I think it is. And then the scapula, which is that big shoulder blade bone on the posterior side of your body. And so we can see on the slide, we've got a nice image here. We can see the clavicle, the sternum, the scapula, and we can even see the humerus here. So for today, we're going to be trying to figure out kind of how all these things interact and how we can accurately describe them in terms of movement terms. So let's go on to the next one. So here we can see a huge list of muscles and some information on all of these muscles and how they act on the shoulder girdle. So we can see a pretty good list here. We got the rhomboids, levator scapulae, pec minor, serratus anterior, and trapezius. Now, what we have on the slide is the origin and insertion for all of these muscle groups. Now this is something, and like I have a PhD in sport physiology, homies, I can't remember this stuff. This is something that you're gonna need to have a table, which I have made for you, and reference later, right? If you wanna try and memorize all this stuff, that's awesome, and my hat's off to you if you can do that. I personally cannot. However, we still need to know these things from time to time. It's just not worth your time trying to memorize all of these things, at least all the time. So we can see for each one, we have the origin and insertion, which we talked about in the last video. And if we know the origin and the insertion for each muscle group, we can start to do like a little vector analysis and start to figure out, okay, well, if I know it starts here and ends here, and if the muscle can only shorten, I have a pretty good idea of what types of movements that muscle is capable of. But unfortunately, in order to benefit from that information, we have to be able to identify all of these anatomical structures and landmarks, which can be challenging. So if you haven't taken an anatomy and physiology course before, some of this might be a little overwhelming, and that's okay, don't worry about it too much. We've also given you the short Reader's Digest version on the side where it says action. So you'll see for each muscle, we have the origin and insertion, and then we have a description of what actions it can do. So we can see things for like the rhomboids is responsible for doing things like scapular retraction, which would be pulling the shoulder blades back, downward rotation of the scapula, which is pulling them back down into anatomical position when they've been raised up. And we can actually see elevation in some cases where they actually pull them up high. So each one of these muscles has a description on here. So we're just going to go kind of, I don't want to say briefly, but really we're just going to hit on the muscle actions and not spend a lot of time on the actual origins and insertions. This is here for your reference, so you can look this up later and have a better understanding of A and P. So we already touched on the rhomboids. Another one that we want to be concerned with the shoulder girdle is the levator scapulae, and this is going to be responsible for scapular elevation as well as downward rotation. Now, some of these might sound a little foreign if you haven't been around this kind of lingo before. Don't worry, we're going to describe all these a couple more times throughout this lecture. So if you're already feeling lost, just hang in there. We'll go through it again, no worries. pec minor, really, really hard to see because it's really deep in there and it's covered up by that pec major, right? This is another one that's going to be acting on the shoulder girdle. It's going to be responsible for scapular protraction, which is kind of a weird one that we don't think about too much. This is where we're actually kind of winging our scapula out and forward like this. And then we're also going to be doing depression and downward rotation of that scapula. Another one that's really cool is the serratus anterior. That's this weird one up here that gives your abs that like nice, cool, jagged saw blade kind of shape up by the ribs. Really, really neat looking. This one's going to be involved in scapular protraction and then upward rotation, so bringing them up and kind of flaring out. And then last but not least, we have the trapezius, which is a gigantic muscle. And if you actually look at the origin and insertions, you can see the scope of the actual muscle itself. I mean, it's humongous. So generally it's broken down into 3 regions because it's so large. Typically the upper traps are differentiated from kind of the middle traps and the lower traps, as you can imagine, starting superiorly and working inferiorly. So it's generally broken down into 3 regions. They have some kind of synergistic roles together. So the major things that we'll see are elevation of the scapula and clavicle. That'd be for the upper fibers. Elevation, upward rotation, and retraction of the scapula for kind of the more middle fibers. And then for the lower ones, depression, upward rotation, and retraction of the scapula. So we see some synergy there, but slight differences as well. Again, this is here for your information. I would not waste a lot of time going through the origins and insertions to the point where you can announce them verbatim. That's cool if you can, and that's awesome. I can't do it, and I have a PhD in this stuff, so that should tell you something, right? So here it is there for your information to reference at a different time. Now, some of these muscle actions are things that you should be at least rudimentarily familiar with. So if I was to say, true or false, the rhomboids are involved in scapular retraction, you should pretty readily know the answer to that. Some of the other ones, like which ones do downward rotation, upward rotation, still in your benefit of knowing, but maybe lesser importance, but definitely the gross movements like elevation, depression, protraction, retraction, you should be able to answer those pretty readily. So this might be a good thing to look at if you haven't looked at that before. Let's go on to the next one. So here we can see what these muscles actually look like. So no big surprise, that big one leading up to the neck over by the clavicle, that's the trapezius from the anterior view. We can also see the serrati anterior under the armpit, kind of up in the upper rib cage here. It gives it that nice kind of jagged saw blade mountain range kind of look. On the right, we can see that pec major, which is really, really hard to see in a lot of anatomical diagrams. If you actually look at the diagram, they actually cut the pec major by the humerus and then over by the sternum so that you can actually see the pec minor and the way it interacts on the scapula, which is pretty cool. And then last but not least, we have a posterior view where we can see the trapezius from another angle and we can see how big it is, right? It goes all the way up to the back of your head and goes all the way towards your lumbar spine. I mean, it's huge, it's gigantic. We can also see the levator scapulae, which are going to be involved in that scapular elevation. And then, of course, we can see the rhomboids, which are going to be very important for scapular retraction. So just in case you haven't seen these before, here's just a quick version of what some of these look like. Hopefully you've seen them before. All right, let's go on to the next one. So here is a diagram of the bones of the shoulder girdle and shoulder complex here. And we're not super concerned with all of the landmarks in this diagram. There's just a few that are worth noting, and we've kind of highlighted here for you. So first off, the shoulder girdle has a number of joints that we should be aware of. The first one that I want to point out is the sternoclavicular joint, which is where the clavicle meets the sternum, right? Sternoclavicular. And you can see that on the far right-hand side of this image. So we see the manubrium of the sternum interacting with the clavicle. On the kind of the opposite side, we have the acromioclavicular joint, which is where the acromion actually interacts with the clavicle. So acromioclavicular, acromion, clavicle. And then last but not least down here, which we're going to talk about a little bit later, is the glenohumeral joint, which is where the humerus, or the arm bone, actually interacts with the glenoid fossa of the scapula. And this is going to be our nice ball and socket joint where our arm will be able to rotate around and do all sorts of cool movements. The other joints in here aren't quite as mobile, obviously, as you probably have guessed. The sternoclavicular joint, the AC joint, don't move around too much, and when they do separate, it becomes kind of a problem. We can also see some other landmarks here, which we're not going to spend a ton of time talking about. The bicipital groove, the lesser tubercle, greater tubercle on the humerus. This is where a lot of action in terms of insertions occur for a lot of the muscles acting on the humerus. There it is. I knew it was coming. And so this is kind of what we're looking at least from the bone's perspective. Now, once we know how all the muscles kind of interact on these bony structures, we have a pretty good idea of what types of actions they'll be able to do. So that's something that I would encourage you to play around with in your free time. If you're really, really interested in these topics, find the origin insertion of those different muscles and see if you can do like a little mini vector analysis and see what the line of pull on those muscles would be. And that would make a lot more sense as we discuss this. All right, let's go on to the next one. So here are just a friendly reminder of some of these movement terms, right? So if we're talking about something that does scapular elevation, that would be where the scapulas are raising superiorly, right, towards the head. So I'd be doing kind of this shrugging motion. So an example of an exercise might be like a dumbbell shrug, that's scapular elevation. When they come back down to anatomical position, that's what we generally call scapular depression. And usually, at least I physically can't, I don't know anyone who can, but usually depression doesn't tend to go too below anatomical position unless they are forcibly moved below that. So typically when we're talking about scapular depression, we're talking about kind of a return to anatomical position unless by force moving below that, but typically it doesn't happen too much. On the right-hand side, we see protraction and retraction. This is one that's going to be very important for us as we talk later on, where we're going to actually see the scapulas being protracted, meaning kind of coming forward and kind of winging my back out. And then if we're talking about retraction, we'll be pulling my scapulas back together, right? A good example of an exercise where we'll be doing some scapular retraction might be any of our rowing variations, like a bent over row, where we start protracted and move into a retracted position, right? And then last on here is the rotational ones, the upward and downward rotation. The rotation ones are simply where we have the scapula and it's moving up and turning out. That's upward rotation. Downward rotation is kind of the same thing as before, a return to anatomical position. So sometimes people get a little bit confused on this one. You can think of upward rotation simply as the scapula is kind of elevating and then the bottom pointy end of the scapula is turning kind of laterally, so it's kind of moving up and out like this. Really easy. And then downward rotation is typically when it's returning to anatomical position, or in some cases, if you can really torque your shoulder, you'll actually be pointing that pointy end of the scapula back towards the medial side of the body. And then here's just another graphical representation of what some of that stuff looks like. Same thing, just a different diagram. Hopefully it makes some sense. So we kind of like to review some of these terms. I know we talked a little bit about it in the first lecture. We want to hit it again in the second lecture, just to be clear. So whenever we say, hey, protraction, retraction, abduction, adduction, we always know what we're talking about. Okay, so what we find is that typically the movements of the clavicle and scapula generally are complementary to movements of the humerus. And so we usually say that the shoulder girdle and the shoulder joint are coordinated. And there are some kind of exercise examples where we might see like isolated movement of the clavicle and scapula without corresponding movement of the humerus, but those are few and far between. There's only a few examples that I can think of off the top of my head where we actually are moving the scapula without really moving the arm around too much, right? Typically in sport and exercise, all of those movements usually involve movement of the humerus and then a corresponding movement of the clavicle and scapula as well. So here's just some examples, right? If you were to throw a ball, it's very difficult to say like I'm actually moving the humerus by itself or I'm moving the scapula by itself. They're coordinated, right? Same thing with like trying to make a tackle and somebody in football or rugby trying to do a counter movement jump or any number of other examples. So what we want to keep in mind is that yes, the scapula and clavicle do kind of have their own independent movement characteristics, but typically they are complementary, meaning like synergistic to movements of the humerus, which we're going to talk about in a little bit here. All right, let's move on. So here are some examples of some movements that we've already talked about. We have like abduction, adduction, flexion, extension, all these things. And so typically what we're talking about in those movements is movement of the shoulder joint, that glenohumeral joint, right? But what we also see is even though I might be abducting my arm and we might just think, okay, well, it's just there at the humerus, right? We actually also see a corresponding movement at the shoulder girdle as well. So in this case, if we look at abduction, where I'm moving away from the midline of the body, right? Not only is my humerus moving out, but I'm also seeing elevation and upward rotation of the scapula. So they are coordinated and synergistic. So it would be incorrect to assume that those things are happening independently throughout that movement. And so we see more examples of that as we go through, right? So for adduction, kind of the polar opposite. As I move to the midline of the body, I'm going to see depression of the scapula and downward rotation back to the anatomical position. If I'm flexing the shoulder, which would be my arm coming out like this, we'll see elevation and upward rotation of the scapula. Vice versa, if I'm extending, meaning moving back, or even hyperextending, like going back behind the midline of my body, we'll see depression and downward rotation of the scapula. And then for things like horizontal abduction and adduction, it's a little bit different. This is something that I think people get confused, and we'll talk about in a little bit. But for horizontal abduction, which would be moving away from the midline of my body, we'll actually see scapular retraction. So if I'm moving my arm away from the midline of my body in a horizontal direction, I actually have to retract my scapula to do that. And in order to bring it back to the midline, I have to protract my scapula to get it back in place. Make sense? So take a look at this one. It's going to come back later to give you a friendly reminder. Let's go on to the next one. So when we're talking about the shoulder joint now, we're generally referring to that glenohumeral joint, which is where the humerus joins the glenoid fossa in that nice ball and socket type joint, right? This joint can do all sorts of fun different movements, and it can do a pretty unique one that we'll learn about in a second called circumduction. So when we're talking about the shoulder joint, we're generally referring to all the muscles and structures resulting in movement of the humerus, which is that main meaty arm bone up here, right? So generally anything that's going to act directly on the humerus, which there are many. So we know that there are a number of different muscles and structures involved in moving the humerus. What we have to keep in mind is that not all of them are necessarily generating large, gross movements, or not necessarily prime movers, meaning the muscles that are primarily involved in generating the movement. We have some really big muscles that do that, and we also have some smaller muscles which can do small movements, but sometimes just play a role in stabilizing that shoulder joint itself. And we're going to learn a little bit more about that as we go. So we kind of have a good mix of small muscles, which can do finite movements and stabilize, and we have big muscles, which can also stabilize, but also generate really, really gross movements, like horizontal adduction, stuff like that. There's another one. All right, let's go on to the next one. So one of these groups is very common for most people is the rotator cuff, right? The rotator cuff group is a collective group of about 4 muscles, and these are relatively small muscles that act on the scapula, or actually, usually start on the scapula and act on the humerus, and they're generally involved in stabilizing the shoulder joint against unwanted movement. So we have 4 muscles, and we can see the same kind of chart here. We have origins, insertions, and actions for all of them. So we can see supraspinatus, generally involved in abducting the arm, the infraspinatus, external rotation, subscapularis, internal rotation, and then teres minor, external rotation. So again, we're going to show a graphic of these in a second, but if you look at the origins and insertions, and you're ever confused, you can do that little vector analysis and say, okay, well, if I start here, I finish here, and the muscle can only move in this direction, I can figure out what that movement is going to be. So let's go on to the next one here. Here we can see what this looks like, where they kind of line up on the scapula, and we can see a lot of these kind of are pretty big. They take up a really big chunk of the anterior or posterior side of the scapula. So we can see the infraspinatus, right, is infra, below the actual spine of the scapula, whereas the supra is above. Supraspinatus is above that spine, and we can see a couple of the other ones like the teres minor, right? So again, if you haven't seen this before, it's just meant to introduce you to this idea. Now keep in mind, although they look really large, compared to things like the latissimus dorsi, the trapezius, the pec major, these are relatively small muscles, and they're not going to be generating really, really gross, huge, forceful movements. These are primarily going to be involved in stabilizing the shoulder joint through dynamic movement. So very, very important role, just less in terms of generating powerful, large, gross, forceful movements. Okay? So here now we can see in this next chart, movers of the humerus. So we can see there's a number of different ones up here. So movers of the humerus, really, really big muscle groups involved here. So what we can see is, again, origins and insertions for all of these. And again, we don't want to go through it because I know you don't want to hear me just read off this table. That's obviously really boring. It's there for your information, so it's there for you to reference later on if it ever comes up. And we can see the actions for all these different things. So if we're looking at the first one, the latissimus dorsi, the lats, right? That big, huge fanning muscle of the back that gives you that nice, cool V-tapered look, right? What are the primary roles there? Well, we can see it's involved in extending the shoulder, abducting the shoulder, retracting the scapula a little bit, internal rotation of the humerus, and horizontal abduction, so horizontally moving away from the midline of the body. Teres major actually shares the same insertion point, I believe, and has a very, very similar role, and it's like right in there with the lat. So when we see a picture of it in a minute, you'll be like, oh man, that looks like it's almost the same thing, and it's close, but not quite. And that's involved in extension of the shoulder, abduction of the humerus, retraction of the scapula, and internal rotation of the humerus as well. Next, we have kind of a collective group, the deltoids. So most of us are familiar with the deltoids, especially if you're involved in gym culture, obviously, right? So when we're talking about the deltoids, it's a really kind of big fanning, broad area of the shoulder. And generally we break it down into 3 groups, kind of like we did with the trapezius. So first we have the anterior portion of the deltoid. Sometimes we'll call the front delts or the anterior delt, right? And that's this front portion here on the anterior side of my body. Now keep in mind, not nearly as big as the latissimus dorsi, right? Our delts, we're talking about like muscle groups the size of like fingertips. They're not really quite that big, but they do span pretty large area. Maybe not compared to the pec and the lats, but relatively speaking compared to like the rotator cuff muscles, pretty big. So the anterior delt is going to be involved in abduction, flexion, and internal rotation of the humerus. The medial delts are that lateral portion out here, kind of right in the middle, medial, right in the middle. That's going to be one of our big prime movers for shoulder abduction, meaning out to the side here, right? And then the posterior delt is that back portion, that posterior portion of the deltoid. And that's going to be involved in abducting the shoulder as well. It's going to be more involved in extending the shoulder and externally rotating that humerus. So we can see this big kind of group of musculature. They all have a commonality in that they contribute to abduction, but we can see some slight differences on the anterior and posterior side of the deltoids in terms of which muscle actions they do, resulting in their differences in origin and insertion points, right? So pretty cool stuff. And then last but not least on our list, pec major, only trained on Mondays. Remember that, that's mandatory. We know that the pec major is that big, huge chest muscle that all of us are trying to practice flexing in the mirror. The Rock's really good at that. I wish I could do it like The Rock does. There's a lot of things I wish I could do like The Rock does now that I think about it. Speaking publicly, one of them, making videos. Anyways, getting back to it, what does the pec do? Well, the pec's involved in flexing the shoulder, adducting, horizontally adducting, and internally rotating that humerus. So lots and lots of stuff there. So let's go on to the next one real quick. Here we can see where these muscles are on the body, right? So in the anterior view, we can see the pec major, that big beefy muscle from the sternum all the way up to the humerus, right into the armpit. That's pectoralis major. Above that, we can see the deltoids, and we can see it from both the anterior view, and then if we switch to the posterior view, we can still see the deltoids because it's that really wide fanning group of muscles, right? So on the front side, we get a view of the anterior and medial fibers, and on the back side, the posterior view, we get a view of the medial and posterior fibers. And now we can also start to see the latissimus dorsi from a couple angles, and we can see how big that muscle group is. It's gigantic. And we can see right above it, which looks like it might be part of the lats, but it's actually covered up by the lats. So in this picture, we actually had to cut the lats away or cut some of the muscle like the trap away just to actually even see that teres major, which looks very similar and plays a very similar role, slightly different. So if you haven't seen these before, this is just meant to introduce you to where these are on the body. Hopefully you've seen some more anatomy stuff before this lecture. All right, let's go on. Here's just a friendly reminder, again, of some of these movement terms, and I just want to reinforce them because this is what we're talking about today. We're talking about shoulder. So if I want to talk about shoulder flexion, that would mean from anatomical position, moving my arm straight out in front of me, like so, right? So kind of like doing a front raise type exercise. If I was to do shoulder extension, it would be the opposite of that. I'd be moving back towards anatomical position, and I can even hyperextend my shoulder, pushing it back beyond the resting position. So flexion's kind of up, extensions all the way back towards the midline, right? On the other hand, we can do abduction and adduction. So I like to say abduction or adduction because they sound so similar. Abduction is to abduct, to take away. So that would be my arm moving away from the midline of the body. Adduction, like adding, would be to add it back to the midline of the body. So away, back to the midline. We can also do medial and lateral rotation. So lateral rotation would be moving my arm or my humerus and rotating it away from the midline. Medial rotation would be moving my arm back towards the midline of the body. So away, back towards. And then one kind of unique movement that we can see with the shoulder is this weird circumduction. So the name circle, is kind of a circular motion where I can actually rotate my arm 360 degrees basically if I could. Not quite 360, but pretty close, right? So this is a combination of doing both flexion, extension, abduction, adduction, and some rotational characteristics. So it's kind of a hybrid of all of them. And it's one of the few joints that can actually do that really effectively. So it's kind of unique. So we can see the shoulder is actually capable of this circumducting movement from front to back or the other way around. Okay? Just want to be clear on those terms. So one thing that I think a lot of people get confused about when we're talking about movements of the shoulder is when things become not necessarily in the prime typical anatomical direction. One of the problems that we see a lot is people get confused when we move into horizontal movements, whether I'm lying supine and doing a horizontal movement or standing up and doing a horizontal movement. So I think one thing to keep in mind is always keep those directional terms in the back of your mind. So a lot of people will say like, well, this is always abduction, right? Not necessarily, right? Abduction means away from the body. So if I'm actually lying on my back, right, abduction would be to actually move away like this. So a lot of people just say like, well, the upward phase is abduction, right? Well, what about like a bench press or something like that? If I'm doing a bench press, the upward phase is actually adduction in the horizontal direction. Why? Because my humerus started out to the side and is now moving towards the midline. So one thing to keep in mind is just don't always take the diagrams as your only understanding, right? You should understand things like abduction and adduction from their definition standpoint, meaning either moving away or towards the midline. And then when you see something funny like a horizontal movement, you can say, okay, is it moving towards or away from the midline? Now I can properly identify this movement and not just base it on the pictures that I've seen, right? All right, going on to the next one. Here's that graph again, or table, I should say. And now we kind of get a pretty good idea. All right, so if I'm doing these different movements of the humerus, there is a corresponding movement of the scapula, and clavicle as well. So again, they're coordinated. If I'm doing abduction, right, it's not just my humerus moving around, it's this entire girdle between my scapula, my clavicle, the humerus, right? This whole thing is moving around, and there's a corresponding movement of all of those soft and hard tissues. So good thing to reinforce, good thing to always look at, and it's going to come back and help us out in a little bit here. So let's move on. Now I just want to give you some examples of things that you'll see in exercise and sporting contexts. One of the problems that a lot of people will have is they'll see an exercise or they'll see a sporting movement, and the first thing they want to do is figure out like which muscle groups those are being, which muscle groups are being used, so that you can go and train them more, right? Obviously, the problem that we see a lot of the times is kind of a miss or identification or an improper identification of what is actually going on in that movement, thus leading to an improper diagnosis of which muscle groups are being used or how to train. So one of the things we want to figure out, right, is what is the actual movement that is occurring? Is the person abducting? Are they flexing? Are they extending? Are they internally rotating? Medial rotation, lateral rotation? What's going on? Well, if we can figure out and describe accurately what those movements are, now we can go and reference those handy tables that I put together for you and figure out, okay, well, if this movement is occurring, I know that only a certain group of muscles are responsible for generating that movement. Therefore, I can figure out which muscle groups they are and which muscle groups I can train to make them stronger, right? So, for example, if the shoulder or the humerus, if in this particular instance, is internally rotating, it is likely that the subscapularis is contributing to that movement because internal rotation is one of its primary actions, right? So that's kind of the process in which we want to go through and identify. First, we have to figure out what is the actual movement. Then we start to think about, okay, well, which of the muscles that I know of can generate that movement, at least in a concentric way. So we can apply the same process to the prime movers and supporting muscles and structures of all sporting and exercise movements. So let's go on to this next one. First example, easy one hopefully, right? Lateral raise. So we have the dumbbell lateral raise. We start at the side, work our way out up to about 180 degrees with the clavicle or so, roughly the same. So what are the correct movement terms? And today we're talking about the shoulders, so we're going to focus on that. What are the correct movement terms going on here? Any guesses? All right, first off, we got some shoulder abduction going on, right? So we started at the side, moved away from the midline. Well, if I know it's abducting, I can figure out, well, which muscles actually contribute to shoulder abduction? Let's take a look. So what would some of the agonist muscles be? Well, probably all of the deltoids to some capacity, the anterior, medial, and posterior. Medial deltoid probably taking a big brunt of that. And we might see some contributions from the supraspinatus. Why? Because those muscles contribute to shoulder abduction. Now, tricky question. Can you describe the downward motion for me? Think about it. Now, what you should be thinking about is not only our directional terms, but also our muscle contraction terminology at the same time. So would it be accurate to say the downward phase is adduction? Yes, it is. You're still moving towards the midline of the body, right? Would it be appropriate then to say that if I'm adducting after doing this lateral raise, that I am using my shoulder adductors? Ooh, this is where it gets tricky. Not quite. So in this case, what we're actually seeing is the downward phase is still being controlled by the abductors. Now they are doing that eccentric muscle contraction, they're generating force, and they're lengthening. Although they are moving towards the midline, they are technically adducting. The abductors are still the primary muscles involved in controlling that movement. Now the adductors can play a role in stabilizing that movement and giving some co-contraction, but in this case, right, the big movers are still, even on the downward phase, are still going to be the abductors, the abductors. So it gets a little tricky. So we want to make sure we're also thinking kind of about vector analysis, gravity control, all of those things like that. So in the lateral raise, our prime movers are generally the medial deltoids and a little bit of assistance from the other deltoids as well in the supraspinatus. And on the way down, even though we're doing adduction, we're coming back, those same muscles are still controlling the movement with an eccentric muscle contraction. Makes sense? If that's not making a lot of sense, go back and review the muscle contractions we talked about in the first lecture series, and I think that will help you understand this a little bit better. If not, post those questions on RP Plus and we'll get you going. All right, let's look at the next one. Lat pull down, one that we see all the time. So can we describe the movement terms accurately in the lat pull down? Let's take a crack at it. So what do we have? We see some shoulder extension, and then we're also seeing a combination of scapular depression and downward rotation, right? Cool. Well, if I know that, I can figure out which muscle groups can do those actions, right? Now, it's called the lat pull down, folks. Hopefully it's not rocket science here, right? But which muscle groups are involved? Well, certainly no brainer, the latissimus dorsi. That's going to be a really, really big generator of the force for this movement. It's going to be helping pulling that shoulder down into extension and pulling it back, right? But we're also going to see some contributions from the teres major, probably a little bit from the lower traps and the rhomboids as well, as we pull our scapulas back into position at the bottom end of that movement. Make sense? See how we're kind of breaking it down where we say there's a movement, I'm not sure what's going on. Can I identify what's happening appropriately at the shoulders? Yes. Can I identify the muscle groups that generate that action? Yes, I can, absolutely. All right, next one, bench press. Again, only performed on Mondays, National Bench Day. What are the correct movement terms? Well, in this case, this one's a little goofy because now we have a horizontal component. We're kind of outside of our traditional anatomical position, right? So what we're actually seeing is we're starting with the arms out at the sides and moving towards the midline as they come up, right? So in this case, we're actually seeing horizontal adduction as our prime action here, right? So we're going arms started at the side and essentially are finishing close to the midline. That's horizontal adduction. And then we're also going to see, as we come up, typically some scapular protraction as well. Now, most of you know with really good bench technique, you don't want to completely protract your scapulas out, but it's a normal part of the movement. In order to generate this horizontal adduction, I have to protract my scapulas out a little bit, right? So now that we've identified the movement, can we figure out the agonist muscles involved of the shoulder? Absolutely. So we know that the pec major hopefully is no brainer, just like the lat pull down. Pec major is going to be involved in that bench press. We also know that that deep pec minor is going to be involved. And then to a small extent, we're probably going to see some synergy with the anterior deltoid as well. Make sense? Hopefully not too challenging. Those are good exercise examples. Let's do a sporting example. One of my favorites, spinning back fist. Yes. You guys like MMA, kickboxing, Muay Thai? Yes. All right, so what's going on here in this example? So our exercise examples are pretty cut and dry, make a lot of sense, right? This one's kind of wacky. So let's use that same approach to figure out what's going on with the spinning back fist. So what are the correct movement terms? Well, essentially, I am starting from probably a fighting position, and then I am moving my arm out and across, right? So I'm moving away from the midline of the body. I'm horizontally abducting out. And in order for me to horizontally abduct, I have to also retract my scapula. So now I know what the movement terms are. Can I figure out which muscle groups are involved? Absolutely. So we know that the posterior delt is going to be a big part of that. The latissimus dorsi, the rhomboids, and then probably several sections of the trapezius are going to be contributing to that whipping arm around movement as I try and punch that other guy in the face, right? Make sense? So this is just a basic example of things that we're going to keep talking about in our movement anatomy series. We started with the shoulder, it's really complicated, and we're going to work our way down. So next time you see me, we're going to talk about the elbow. So thanks for joining me today, RP Plus, RPU. It's been a pleasure. I will see you next time.